Like a migraine or backache, we should seek help for mental health issues early so as to avoid problems that are more challenging to address later on. To that end, we have set up 43 community outreach teams and trained over 24,000 frontline staff from government agencies and community partners across Singapore to identify persons with mental health needs in the community and refer them for appropriate support. As of December 2019, we have reached out to over 300,000 persons and provided assistance to more than 23,000 persons who were at risk of developing mental health conditions or dementia. Ms. Anthea Ong should also be assured that physicians are bound by duty and ethics to protect patient confidentiality and to ensure data sharing and use for patient care purposes only for all medical conditions, not just mental health. Healthcare institutions are also required by licensing conditions to safeguard confidentiality of medical records. Specifically, our public healthcare institutions have implemented safeguards to ensure access by authorized users on a need-to-know basis. Severe disciplinary and enforcement actions are taken against users who willfully breach patient confidentiality. Organizations must also comply with the Personal Data Protection Act. For outpatient treatments of mental health conditions under the Chronic Disease Management Program, which includes depression, anxiety, including obsessive compulsive disorder, OCD, so that's included in CDMP, bipolar disorder and schizophrenia, CHARS cardholder may tap on subsidies of up to $500 per year for treatment at CHARS GPs, and more for our Pioneer and Merdeka generation cardholders. Patients can also withdraw up to $500 per year from their MediSave for outpatient treatment for conditions under the CDMP. In 2018, only about 2 in 10 patients who withdrew MediSave for their outpatient mental health treatment reached the yearly withdrawal limit. To further defray the cost for patients with complex chronic conditions, say a patient with OCD and osteoporosis, we will be raising their MediSave withdrawal limits, and further details of this will be shared by SMS Tong. Singaporeans who still require financial support after tapping these schemes can apply for MediFund from our public healthcare institutions. We must also not forget that the well-being of persons with mental health conditions often rests on the caregivers, and the caregivers are at risk of burnout. Hence, we will be piloting a structured system of support for caregivers of persons with mental health conditions. Under this system, upon first diagnosis of their loved ones, hospitals and community partners will provide caregivers with information such as disease progression and expected care needs, and link them up with the necessary health, financial, and social support services. With this, we hope that caregivers will know upfront that they are not alone, that there is an entire network of support for them.